Welcome everybody if you've just joined us to the IHW Council's second edition of India Immunization Summit 2023. In this panel discussion over the next 1 hour, we'll also be touching upon an equally important subject, which is immunization for the employee well-being. As we know that vaccines are the most cost-effective and proven method to remove, reduce, eradicate disease, a whole host of disease. And this is important for not just children, for women, but also for employees, their families. And we'll discuss the role of corporates, institutions, organizations in actually making immunization a part of their well-being portfolio of offerings towards their employees. And I could not have asked for a better panel to discuss this subject. I have Dr. Ashish Mishra, Chief Health and Wellbeing Officer, South Asia for Hindustan Unilever Limited. Dr. Mishra, welcome to this discussion. Dr. Major Bishwadeep Paul, Senior Director, Medical and Occupational Health at Procter & Gamble, India, Middle East and Africa, and also the President of the Indian Association of Occupational Health. Welcome, Dr. Paul. My surnamesake, Dr. Preetpal Thakur, co-founder of Glamio Health. Welcome, Dr. Thakur. Mr. Jose Peter, co-founder and CEO of Arogya Finance. Welcome, Mr. Peter. So let's dive straight in. Over the next 1 hour, what we intend to discuss is this subject, its various gamuts. I will be asking our experts about their insights on the role of immunization as an adjunct for various health and well-being initiatives that they are operating, running, planning, or speak about the impact that it has created when we look at the larger workforce and their well-being. So, Dr. Mishra, let me start with you. For the benefit of our viewers and the audience and the delegates, could you just help us situate where immunization sits within the entire gamut of health and well-being offerings for employees for an organization like yours, or generally speaking for India Inc.?
Thank you for having me here. Yeah, in the corporate world, for last many decades, the focus has been on non-communicable diseases. And as a part of it, it has been thought that the behavior change programs would be the way forward, and that's where the focus has been or had been till we had COVID to really wake us up to say that, well, the infectious diseases haven't gone anywhere. Though we have had these reminders time and again. We did have H1N1 in 2009-10, but somehow our memories are short and we forget about those, and it goes forward. The reality is that the infectious diseases are very much there. And it's the infectious agent is not just about the active disease that it causes, but they have an impact on many of the so-called non-communicable diseases as well. So, for example, COVID and the thromboembolic phenomena it causes, and consequently the cardiac issues that comes about, other viruses do that as well. And then you have the HPV, which causes cancer. So there are these infective agents also causing what supposedly is seen as a non-communicable disease. So the point is that the infectious agents are around and are going to be around. And the way to tackle a keystone, a cornerstone really to tackle the infectious agents happens to be the vaccine. And that's where, the vaccination programs are vital and has to be focused on, because that's the way forward. Any disease that we have vaccines for, we should be incorporating those and taking those forward in terms of having a holistic health and well-being program. Otherwise, just merely focusing on certain aspects of it is not going to get the holistic health in the organization. And that's where it is, again, the whole challenge comes up is that, the popular belief is that the vaccines are for the kids and the childhood immunization program works well. But it's equally important for adults. There are vaccines which are very specific in there, and that's what we have incorporated in the company as a part of our policy to be providing certain vaccines, and we run these programs now.
Right. So they form an entire gamut of your health and well-being offering for your staff and employees, you have a wide spectrum that you look after, covering South Asia. Are attitudes and approaches different across the world, or as HUL, you take a similar approach across geographies?
Well, the attitudes and practices of the individuals surprisingly is pretty much the same. Barring a few geographies where the vaccine acceptance is better than others. For rest of it, vaccines are something which people don't see the immediate benefit. And we saw that in COVID, right? The first dose of vaccine, everyone wanted to have the first shot that was available. And by the time it went to the second dose, it was already dropping. And the booster dose, when it was available, there were few people who were taking it. So unfortunately, the perception of a threat and the vaccine, they don't go hand in hand, because this is a preventive thing which, it's hard to quantify the prevention part of it, or at least perceive that the importance of prevention. So that's the challenge. In terms of the offerings, it changes by the geography. There are some countries where, the government has a big role to play in covering these vaccines. For the others, it's about really left to the population to do that. And in general, the adult vaccines are really left for the individuals to take. And across South Asia, I can certainly say that's where it is. So we have been trying to incorporate in our policies sustained ways in which we can, provide the vaccination to the employees.
Right. And what are some of the vaccines that you would cover as part of your program for your employees?
See, the recommended ones are influenza annually, pneumococcal vaccine once someone turns the age of 50. That's certainly recommended. Hepatitis B for the first responders and the medical team in the company. So anyone who is likely to be exposed to the body fluids. Then we have typhoid, again, partly in terms of where the risks are, like people who frequently travel and the water quality could be suspect. So the sales team which are in the field. And also we do have certain factories where it's a requirement. The foods factory, there is a requirement that the food handlers and anyone with those products have to be immunized against typhoid. It's once every 3 years. And then we also insist on, or at least trying to put this up on HPV for the adolescent girls in the family. So the coverage that we provide is not just for the employees, but it's the employees and the dependents.
Right. So, and also, and it's heartening to know that you're actually customizing this for the risk profile, age profile, demographics, etc. So it's a well thought out program, and I think that's a good industry practice to be followed across the board. We live in the age of infectious diseases. We as you had highlighted, but we also saw that during COVID, it became a strategic imperative for organizations to keep the workplace safe, to have everybody immunized. As we go forward, do you think that immunization will become even a bigger part of the well-being offering, not just as a well-being offering, but as a strategic imperative to keep the workplace safe from each other, as it were?
I certainly wish that our memories don't fade out of, and there are these learnings that we keep alive. I think it's clearly a requirement. Okay, it's a need, and we don't have to wait for a pandemic of the magnitude of COVID to hit. In fact, between the two pandemics of H1N1 and the COVID, there have been outbreaks, and these infectious outbreaks will be there, and as the data is suggesting, we'll have more frequent of these outbreaks come up. So we have to gear up for that. There will be diseases, unfortunately, we don't have vaccines for. But then for those we have, at least we knock off those, and certainly a part of the business continuity and a strategic thing to ensure that, for at least the business doesn't suffer from vaccine preventable disease. Really the focus. And
useful insights from Dr. Mishra. But one thread that I like to pick on is how vaccines are actually received by the employees themselves. I mean, there is a employee-employer interplay here as well. Yes, they could be well received as a thoughtful organization doing its best for the health and well-being of its workforce. It could also be taken with hesitancy. We know vaccine hesitancy is a challenge, a problem, a structural problem. It's not just about a few people. And then there could be some resistance also for other reasons, whether demographic, etc. But let's start with the positive. What role and importance does immunization have to actually improve and foster employee-employer relationships? If you could, yeah, just unmute yourself.
Sorry.
Yeah.
Thanks for the question, Karan. And I'm thankful for this forum to actually spread awareness on this very, very important role of immunization at adult immunization also at the workplace. So immunization does play a significant role in improving the employee-employer relationship. And employers are uniquely positioned to support adult vaccination adoption and can take several approaches to support their employees. This is also a part of business continuity, like Dr. Mishra said. For example, employers also need to create an atmosphere where vaccinations are supported by having company executives or managers share their vaccine experiences, because there is definitely a hesitancy where it's not urgent. All right, the urgency is created by a panic, and where there is no panic, people feel that's not going to affect me or impact me. Only those awareness sessions conducted in workplaces where you have someone speaking about the importance of getting vaccines, speaking about the importance of protecting yourself proactively rather than waiting for a condition to hit you, an infection to hit you, and then seek treatment, is something that I see of great value. Spreading awareness, having a program before the actual drive sets in, the campaign, you're rolling out a campaign at the workplace. So whenever each year we do this, we have a campaign. Before the campaign, we have awareness sessions, because that is of a key to have a successful program. Otherwise, you just offer it, people feel that, okay, I'll take it later, or it's not immediate or of urgency, so I can push it further. So that is one of the things. And secondly is, again, support. So employees getting supported by vaccination comes with several benefits which have to be told to them, that they can better protect themselves and those around them. And that is the reason why, along with employees, we also in places offer these vaccinations to their family members as well. So of course, this may be paid or supported by the company, but it is a choice that the employees have, and they can exercise their choice and lower the risk of catching and spreading vaccine preventable diseases to other colleagues in the workplace as well. And also the negative impact on the workforce that it may have if you're not already protected.
Right. Some very important points that you spoke about, and I'll come to those, but could you also throw some light on what P&G does? I mean, again, you operate across geographies, across socioeconomic strata within your employee base also. You spoke about the importance of communicating and having a campaign. So how does your organization go about it?
So pretty much like Dr. Ashish Mishra, my friend, said, P&G also works in a pretty much the same way that Unilever does across geographies. We are a global company, and global organizations have a standardized kind of programs across. So the offerings can be same. The hesitancy is there among people across geographies. However, the communication, the clarity of why are we doing what we are doing, who, and if I lead the way, if the leadership leads the way in various sites, it is seen as a very, very big positive. However, if we are just rolling it out without any, leadership communication, without any kinds of, inspiring talk, sharing of how it has helped me in the past, I think the uptake is much lower there in those sites as well.
Right, right. And let's broaden this now. You also are an office bearer of the Indian Association of Occupational Health, in fact, the president rather. So as your role with that hat, How do you see this in across sectors, across industries? Has immunization become front and center as one of the mainstays of health and well-being for employees? Is it still on the periphery? Has COVID changed it? We'd love to hear your insights on how this has moved over the past couple of years.
Thanks for asking this question. Basically, Indian Association of Occupational Health is a group of corporate and occupational health physicians, doctors, safety professionals, members who are working in the industry, working population. We are committed to improving the health and well-being of India's working population. So this is a journey, I can say, and through our various branches, close to 3,000 members across the country, our aim is to propagate the culture of health promotion and health protection for the workforce. Again, IOH epitomizes the adage that prevention is better than cure, and we are all occupational health physicians. We are doctors of healthy people, and our job is to keep them healthy and be productive at their best in the workplaces. So one of the keys to preventing illness is adequate immunization of the workforce against various illnesses that can be prevented. Globally, we know that vaccine preventable diseases are targeted very effectively through a consensus approach. And vaccination for the workforce, working population does play a significant role here for the organization by reducing absenteeism and presenteeism as well in the workplace. And we also have international organizations like CDC who come out with specific schedules of adult immunizations. However, in India, we did not have such document available. And to address this important issue, we have, as IOH, we have in line with our mission, we have this brought out this journal, this guiding document to keep India's workplace healthy. In fact, Dr. Ashish, Mishra, and many of our senior members in the IOH have actively collaborated and made with experts. We have come together in experts in the field of immunization have come together to prepare these guidelines for adult immunization in the occupational health setting in India. And this committee basically discussed the prevalence first of vaccine preventable disease, did a comprehensive literature survey, and also reviewed the schedules for healthcare workers, pregnant employees, and also vaccinations in context of mass gatherings. So anyone, if you are interested, please feel free to go to iohmumbai.org, and the document is available for download as well.
We are a set of guidelines, they're broad guidelines for organizations to follow.
Yes.
Right. So that's very useful and wonderful to hear this collaborative approach to health and well-being of employees through immunization. So thank you for that, Dr. Paul. Important to talk about what the industry as a whole is also doing and not just a few of the organizations. Dr. Thakur, I'd like to bring you into the discussion now. We've heard what large companies, progressive companies are doing for their employees vis-a-vis immunization. But if you were somebody who's just setting up a health and well-being program or a preventive health program for your employees, or is trying to actually make it a bit more concrete in terms of its expansiveness, how should employers go about creating an immunization program for their employees?
Right. Thank you, first of all, Karan, for having me share my views. So for the benefit of the larger audience, I am one of the co-founders of a company called Glamio Health, which is an asset-light startup focused on secondary care surgical space largely, right? So at the very outset, let me tell you that the average age of the employees in our organization is around 25 years, right? Now, as all of us on this debate would agree, that at 25, you feel that nothing wrong can go to your body, right? Nothing wrong can happen to your body, right? Why do I need immunization, right? I mean, so I'm fit, fine, I can eat junk, I can sleep 3 hours and still be up at the office, right? That's the mindset with which almost 95% of the workforce operates, right? it may work in a normal scenario, right? In most of the organizations, it may work, and immunization certainly in the minds of the founders would be lower in the priority. I would like to admit that, right? But mother of all sort of uncertain events, which is COVID, happened unfortunately a couple of years ago, right? Which caused a lot of scare, and then especially in the COVID Delta wave, when these 25, 28, 30-year-old fellows saw even younger people suffer, right? That is the time when reality dawned upon them that nobody is actually infallible, right? And many things happened, right? So there, from one end of the spectrum where there was absolute carelessness regarding any immunization program, right, to the other end of spectrum where there was an absolute fear, right? So in those times, what we did was that because we are operating in the healthcare sector, so we were fortunate enough to have certain sort of associations or partners with whom we can sort of get our employee workforce vaccinated at the earliest, right? Now, having seen that sort of an extreme phase, right, I think to continue building up on the immunization piece, we required going forward much lesser effort than it would have required otherwise, right? Because COVID did a lot of sensitization, right? But again, as the memory is sort of transitory, so once COVID sort of started waning, and like you rightly mentioned that COVID, the first vaccine, the first dose, there was helter-skelter sort of a rush. The second dose, the rush sort of waned, and the booster dose, nobody could care less, right? I mean, that was the attitude, right? I mean, so what we've done, what we have used is a typical carrot stick approach, which generally works in a startup, right? So we want our employees to focus on 2 or 3 vaccinations which are important for them. First of which is, so roughly 30% of our workforce is women, right? And cervical cancer is a disease which is increasing in prevalence and incidence in Indian population also, right? For cervical cancer, most of us would know that there is a vaccination which, if taken at the right age, has a better propensity of protection, right? That age, I mean, depending on various literature that you would read, is somewhere around adolescence to up to maybe 30, 32, 34, 36, right? That is the age, right? Now, the problem with the Indian population or the Indian population in general is that till the time people start going to their gynecologists, they are already too late. And the HPV vaccination is not that effective for them, right? So what we did was, using the sensitization which was brought in by COVID vaccination, we pushed in HPV vaccine education at our end. And to our surprise, I think 60 to 70% of the people actually opted for the HPV vaccination, right? The other vaccination, because we are frontline healthcare workers, some of us are frontline healthcare workers also, is the hepatitis vaccine. So the long and short point that I'm trying to make is that COVID has increased the sensitization towards the need for vaccination in a startup also, right? Otherwise, startups generally have an age group where people are not bothered about their health outcomes, because by and large, they're hale and hearty.
Right. Important point there about how startups should deal with it or don't deal with it usually. And who are the important stakeholders as you're building an immunization program? I mean, obviously it is, HR departments, but I'm sure you look at the wider universe also of doctors, people who can educate the workforce,
Yeah.
training, etc. Could you throw some light on who you see as the key stakeholder base?
Right. No, so very valid point, right? I think so. When we started the business, like with most of the startups, it starts as a metro-only phenomena, right? So we were largely focused on 6 of the top metros of the country. But as we started expanding, we went to the tier 2 towns, right? And there is a vast difference in the healthcare awareness per se that Delhi NCR person would have versus let's say somebody in a Panipat or a Sonipat would have, even though these two cities are separated by 90 kilometers only, right? I mean, so what we realized was that as we moved towards the tier 2 towns, right, our role largely sort of moved from execution focus to creating an awareness focused also, right? So when you're trying to create awareness and where you would need the help of the public health machinery also, I think the community health centers, the primary health centers, and the nodal officers, they all start becoming an important sort of a cog in the wheel. And contrary to the popular belief or the popular perception, at least what I had before my exposure to them, I think the government officials in these towns are more than happy to sort of help. It's just that people don't go to them asking for that, hey. So if you were to ask people that we need to create awareness and we need help from your machinery, they're more than happy to sort of arrange, go out of the way, right? It's just that private sector does not actually ask the public sector to help, right? Because public sector is replete with resources, education material, and everything, right? I mean, so I think one lesson that we've learned in last couple of years, and again accentuated by COVID, is that the private sector actually would do much better if they were to ask and sort of get help from the public sector. The public sector is available, right? Is our sort of an understanding.
That's a very important point that you've raised there. Usually the public sector, the public health system comes in for a lot of flack in terms of what it cannot do, but it is also the hesitancy on part of private organizations and institutions.
I think it's a preconceived notion that that वहाँ पे कुछ नहीं होगा, right?
Exactly.
Which is not correct. Which is not correct. I mean, is what we've seen.
Yeah, and COVID immunization, the entire program has proven the stability and the ability.
It's an example for the world, right? I mean, 200 crore vaccinations doses, right, in such a country where after every 20 kilometers, the language, everything changes, right? I mean, it's kudos to the public sector.
Yeah, and which is in fact the crux of this discussion is how to expand programs, how to foster partnerships. So very important points there. Mr. Peter, before I come to you, I just want to go back to Dr. Paul. I want to just pick on what Dr. Thakur said, which is very interesting, which is about startups and the startup universe. And we know that India is tremendously progressing in the number of startups that are actually coming to fore, and also the unicorns and soonicorns, etc. But you heard the problem there. It's about a young population feeling immune towards immunization. What can organizations like IOH do to also bring them into the fold?
We would be very happy, Mr. Thakur, that we can join hands and come and spread awareness in your workplaces as well, because awareness is the key. And
certainly, I'm going to take up on this offer, Mr. Paul.
The first partnership has come through in this as a result of this discussion.
Yeah, absolutely. And small and medium industries, startups, IT companies, where typically they don't have an occupational health setup. We require to focus on employee health and well-being, because at the end of the day, a productive employee is much more valuable than an employee who burns out after a few years of a very fast-paced life. So you need to have that kind of pacing as well. Constantly give them inputs and guidance on how they can take care of their health and well-being, so that they are productive in the long term and faithful also to the organization that they are working for.
Right. Very important. Mr. Peter, I'd like to bring you in now. You've heard our other panelists speak about what programs they run, what their philosophy and approach is, some of the challenges and the opportunities, need for partnerships. You also heard about the private sector being hesitant to reach out to the public health infrastructure that is available and more than forthcoming. If you were to then look at the role of private enterprises and organizations in the larger goal of achieving immunization for all, not just for children, but for the adult population also, how do you think and what do you think should enterprises do to become a part of a larger cause for the national immunization mandates?
Thank you, Dr. Karan. So let me take a minute to introduce me and the organization. So I'm Jose Peter, co-founder of Arogya Finance. Arogya Finance is a fintech which is dedicated to healthcare space. The impact of the lack of vaccination and immunization, etc., is what we deal with most of the time, because either people are not insured, or even if they are insured, they are underinsured. So therefore, they have to pay out of pocket where they struggle, and then we are able to some extent help them create extended payment options for them. So that's what we do, and therefore we really understand the importance of this space. The importance from a cons point of view, I think it is well understood that immunization brings in multiple benefits in terms of the employee welfare. A healthy employee is always helpful. Low absenteeism, corporate reputation, all of these are at stake, and I think that is reasonably well understood. But in my view, what is less understood is the benefits of a program like this in terms of its financial implications. Research suggests that any investment in an immunization program has a 16-fold benefit on its investment. So, direct benefits are about 3.2 times by way of, the healthcare cost that an organization can save. So for every rupee that you invest into an immunization program or a vaccination program will result in 3.2 rupees savings in healthcare expenses which that organization spends. So that's a direct benefit. Then there's an indirect benefit of about 2.7, which comes from low absenteeism, etc., and the benefits that brings in. So it's a 16-fold ROI to the investment that you make. I'm not sure how many CFOs, when they sit down to make these decisions, understand the ROI of what we are talking. It's a 16-fold. It's not a 16% impact. Okay, so that immunization or a vaccination program makes immense financial sense, goes without saying. Okay, so now so what is then important is to figure out how do you ensure everyone gets it, everyone takes it. How do you deal with issues relating to short-term costs versus long-term benefits? Because benefits come over a period of time, costs have to be incurred upfront. So the struggle with that, the issues relating to adherence, because there are employees have religious or sometimes other impediments which prevents them from taking these. So how do you incentivize these employees to take it? How do you build that into a model wherein maybe they get additional healthcare benefits if they are immunized? Corporates can probably negotiate better insurance rates if all their employees are immunized, right? So there are benefits plenty out there. It is a question of how do you understand that, communicate even to the CFOs the full impact and benefits of these, and then come out with a program like that. Similarly, of course, employee, the benefits don't stop only with the employee. obviously. It also extends to the families. So therefore, immunization programs have to cover the families, because if a family member is ill, obviously it can lead to absenteeism and lower productivities, right? And also, extending it through the social, the corporate outreach programs. If you are able to reach out to that larger audience there, the benefits are immense. So coming back to your question, Karan, how do you ensure that corporates participate in a universal immunization program? So, which investment in the country could give you a 16 times return? Yeah. Immunization, the research suggests that immunization can, and the vaccination program can. So therefore, it makes immense sense that corporates prioritize such a program in their corporate social responsibility outreach as well. So plenty of benefits out there. That's the way I will put it. Thank you.
Right. So important point that you raised there on the ROI, as it were,
Right.
on the direct and the indirect health impacts, and also on the organizational efficiency as a whole. And
Right.
therefore, if I heard you correctly, CSR funds also should be directed towards immunization programs for the benefits and just the pure ROI they built. Is that correct?
Yeah, that's exactly, because see, when you put money in CSR, everyone wants to see benefits, right? So if I spend 1 rupee for CSR, how much did the community benefit from that? Okay. So I'm not aware of any investments which can give you a 16 times benefit. Yeah, as a finance person. So I think on a standalone basis, if the benefits are brought out well enough, there is enough reason why a significant chunk of the CSR should go into a vaccination or a immunization program.
And
so that's the point I'm making.
And therefore, organizations should actually be expanding this just for the benefits that it brings to their employees.
Right. Yeah. So I think the ethical, today we feel that we are doing all of this for ethical reasons. It's a significant part of the reason. So I'm saying, in addition to the ethical and other issues, there is a hardcore finance benefit out there, both for the organizations and for the society at large. So therefore, prioritization should be, there's every reason to prioritize this.
Right. Dr. Mishra, I'd just like to bring you in. You heard the other voices on the panel talk about the advantages, some of the challenges, but also need for collaboration and partnerships. I wanted to bring in the vaccine manufacturers here. Are you actively engaging with them as well to see how you can have a robust vaccination program? How does that partnership or conversation work? If you could just unmute yourself.
Sorry. Yeah, it's a multi-stakeholder thing, right? So you have the vaccine manufacturers, you have the company, the employees, and then, of course, the insurers in there. The aspect which works out is, yes, there is ROI. All of us understand. We intuitively know vaccines are great, right? It's worked for the childhood immunization program. The important thing is, how do you translate to the adult immunization programs? And of all the benefits that are there, it still becomes a big challenge year to year. And so to get over that, we have been able to get this under our insurance policy. We have multiple insurance policies, but for most of it, we have it. And that actually puts it as an institutional thing. So each year, I don't have to go to business leader now to explain the ROI, because you explain to one leader changes, then you do this year after year. So now it's being part of the insurance, and it took a while. See, it wasn't easy. And then I think the big part is for the insurers first to understand. And in the Western world, it is, as was mentioned earlier, that there have to be actually reduction in premiums if people are immunized, because that's where the benefit comes. It's proven. But then the reality of life is it's still a struggle to get it under insurance. So you have to negotiate, and I hope that expands further, that even the insurance company starts to take it as a frontline thing rather than paying for a treatment. You start to ensure the preventive aspects of it, which still is not mainstream in India. Having said that, coming back to your question on the manufacturers, that's at the back end again. So once you are insured, it's really then between the insurance company and the manufacturers, rather than I going and negotiating with the manufacturer. The rates have to be decided by them. And again, it's a volumes thing. So more the people get vaccinated, the cost of vaccines go down as well. So it's that ecosystem that has to build in. Yes, we have had to do this. We have been doing this for some time now to get the insurers, the manufacturers, and all of us together. But the mechanism which seems sustainable is going through the insurance way for us, so that it's clean, we are paid the premiums, and then it's really the utilization and planning. We don't have to negotiate anything further, because as a corporate, we don't have to negotiate with multiple partners. So
Right.
that, I think, is a sustainable way.
And do you think attitudes across the stakeholder universe have changed because of COVID, because people now see the direct benefits of vaccinations?
I personally believe it's very short-lived. See, the
Right.
thing is, this exactly the same thing happened in 2009-10. The flu immunization after that was at its peak. People wanted flu shots. And come 2012, 13, 14, just see the numbers, it starts to drop. Because again, people don't see this as a perceived thing. Should we use this and keep this memory alive? Absolutely. I think that's one thing as a healthcare professional, that's the challenge that we have taken up. So to say that, let's not forget what has happened, because things get to normal, and how do you ensure that the learnings are not lost? And here again, the challenge is, people, when you say adult vaccine, people say COVID vaccine. Now, COVID is not the only adult vaccine. There's a whole spectrum of it. And how do you translate? Now, we are about to launch our flu shots for this year, because it's pre-monsoon for most of the country. And this is the kind of discussion. Okay, flu shots, but what happens to the COVID vaccine now? The surge is going on. And so I think people have to understand that, like the childhood vaccines, there's a spectrum around. And which ones, and a flu shot or a pneumococcal shot has a same significance as a COVID shot for the space that it works in. And it's not one or the other. So that's the part that, look at vaccines to prevent diseases, multiple things happening. And that's where really our effort is.
Right. And I think COVID also is a double-edged sword. One wants to turn the chapter on it. But if you go back and start talking about it again in terms of even the immunization, I think it touches a raw nerve in many people. So I think we are having to play that dichotomy. Dr. Paul, I'd just like to bring you in onto this. The workplace is changing. Work from home, hybrid working. It's not so easy to get all your employees under one roof now, and especially if you're now geographically remote, or you're spread across the country or across borders. In that case, how do you ensure universal coverage for all your employees in this changing landscape of the workplace itself?
Thanks for this question, Karan. In fact, this is something that we have been doing even pre-COVID. We have sales organization distributed and disbursed across the country. And we do organize through our vendor partners, hospital partners in various parts across the country. We have a reimbursement model as well. Plus, we have this specific, it is a benefit that we give to our people, that they can get it done anywhere and then get it reimbursed. And we also organize camps, micro camps in various parts of the country for specifically this, covering these set of people who are not at the workplace anymore. Home vaccination was another thing that we did launch during COVID, because we understood that people were not coming to office, they were working from home, and the vendors were very, very supportive to help us with the home vaccination program. So that was a huge hit, and it also gave our people a lot of confidence there in the company as well.
Right. And how does one go about actually evangelizing this message across just beyond the workforce, rather? So, I mean, in colonies in which they live, in clusters through which they operate, is there an approach towards this so that this becomes a larger public health movement and not just restricted to employees and their families?
Now that you say about colonies, I know a few colonies where they have such campaigns in the big societies, wherein they call the partners, the hospital partners, and conduct vaccination camps. And the awareness is increasing, I can tell you that. We had a dip in the uptake of flu shots pre-COVID. Now there are people asking us questions that, can we will this help us? Because in between, we did see the H3N2 strain creating some bit of havoc there. So people do ask us about the various vaccine programs, the HPV vaccines as well, and that is where the school can play a big role. The awareness among parents during meetings, etc. That is a very, very good space to be in.
Right. And, and this is a generic question, but first I'll come to Dr. Thakur. Can immunization actually become an attractive tool for startups to show to the talented workplace or to the talented workforce that this is a workplace that you want to be at because we've got you covered? Do you think that it can actually go to that level?
I think it can be added as a benefit, but I think given the age of the workforce, their sensitization towards immunization and the benefits of it is still a work in progress, right? And also, cost of some of these immunization as a percentage of their C2C cost to company would not be materially significant for it to become a reasonably good motivator, so to speak, right? However, I think the imperative lies on the employer, right, to include this, regardless of whether it acts as a sort of a motivator for employees to stay or not, right? Because once you start sort of educating the workforce, you're not only educating them, right? Maybe by virtue of having a family of 3 or 4 folks, you are then able to spread the message and add to something which I would refer as a public good, right? Because if a lot of people in community are immunized, right, the disease transmissions will sort of get affected, and it benefits the community as a whole in a longer run, right? And now, given that startups have started to become as a preferred destination of employment for some of the or a large majority of the working force, right? I think startups as a whole have the weight and the muscle and the reach to sort of deliver or to do their part in delivering this public good is how I would like to see it.
Yeah, that important point there. Mr. Peter, I'd like to bring you in. Our panel is a little skewed towards health and wellness. So, I can understand that, immunization would be front and center. All of them are doctors and, they're very well aware about the importance of immunization for the larger workforce. But not every organization is in the healthcare space, health and wellness, pharmaceuticals, etc. They may be very far removed from health and more specifically disease. For organizations like that, what are the incentive structures? What is the information that needs to go to them so that they're also as aware, motivated, and with structured programs around immunization for their employees, especially when we see what's happening in the startup space, as Dr. Thakur said.
Yeah, thank you. Yeah, so that's a tough one. But my feeling is the first thing to start with is while many on the panel will be very aware of the ROI element, I'm not too sure how many of the CFOs of smaller organizations perceive it that way. So I think there is a lot of selling to be done there in the first place, because at the end of the day, these are guys who will sit in judgment at the end of the discussion. Yeah. So the CFOs have to be fully aware that this is not some ethical trip that we are doing. This is hardcore finance we are talking about. Yeah. So they must understand that. And once they understand that, I think things could start to change in the smaller organizations where these are not prioritized. Second is, if we are able to start influencing the insurance guys in creating packages where I'm sure it is happening in a small way, but it can increase. Where if you have universal immunization or a significant percentage of employees being immunized, then the benefit of lower insurance premiums should flow into those organizations. So that is another language which the finance guys will understand. Yeah. So I think if the financial benefits were not so significant, then the selling becomes that much more harder. Yeah. Then you need to work on what is fair, what is ethical, all of those. But here, I think the financial benefits itself are so significant. So the selling is not so hard. It is just that somebody has to do the job of selling. And through a combination of reaching out to the organizations, smaller organizations, through associations, etc., talking about the financial implications of these, influencing the insurance guys to pass on additional benefits where people are significantly immunized. I'm not talking about getting into an insurance policy where immunization costs are borne by the insurance company. That, okay, you can try and do that. But I'm saying, even if you don't do that, so long as the employees are immunized, they should get lower premiums or higher coverages or whichever manner. Okay, so those kind of negotiations, I think these two-pronged approach, I think should give better results.
Right. So we're at the end of our time here. I'd like to draw this conversation to a close. But before I do that, I want a shotgun response from my panelists. I'll ask them one question each around immunization. Dr. Mishra, if I could bring you in first. If you had the entire HUL workforce listening in right now, and you had a message to give to them on immunization, what would it be? If you could just unmute yourself.
Well, immunization as a whole has proved to be beneficial. In fact, the population of Earth is what it is. One of the top 5 conditions would be because of vaccines, that we are what we are. So vaccines are very important. We have to move away from the mindset of vaccines just being for the kids. It's for adults. And wherever these are proven efficacies, we should get immunized.
Right. Dr. Paul, you're addressing an AGM of the IAOH. You have all the members sitting there. If there was one message that you'd have to give to them on immunization, what would it be?
Again, the performance and productivity of the workforce is so important, and immunization does help in the long term to help actually that. So the business, it is a win-win for the business as well as it is a win-win for the individual who does not have to take unnecessary leave and suffer because of any vaccine preventable disease.
Right. Thank you for that. Dr. Thakur, you are addressing the largest gathering of startup CEOs and founders. What would your message be around immunization for their workforce?
Everyone can be a vaccine champion, and vaccines save lives. Is a simple message that I want to sort of give.
Very pointed and very poignant. Mr. Peter, I think it's very obvious what I'm going to ask you. We're addressing the largest gathering of CFOs, and what is it that you would like to tell them around immunization?
Yeah, I think, sorry, I will have to repeat the same, which is, while we continue the evangelization of vaccines and, immunization programs, a financial evangelization might do the trick faster.
Excellent message. Thank you to my panelists, Dr. Mishra, Dr. Paul, Dr. Thakur, Mr. Peter. It was such a fascinating discussion, and I'm very happy that we actually had some actionables that both employees, employers, doctors who are working in the field of occupational health, CFOs, startup founders can all take out on immunization. So it's very rare that in 1 hour we could address such wide stakeholders, but that's what this brilliant panel has done. I hope the viewers, listeners, and delegates have found this useful. Thank you. Please do write in to us if there are specific suggestions. If there are questions to any of the panelists or you would like them to be connected with you, IHW Council will make sure that happens. And with that, I'll draw this this part of the India Immunization Summit 2023 to a close and hand it back to Dr. Sawant. Thank you.
Thank you. Thank you so much.
Thank you.